Hi, welcome to our channel of IGNOU audiobooks. Indira Gandhi National Open University, School of Continuing Education, Certificate Programs, Certificate in Food and Nutrition, CFN, CFN-2 Your Food and its Utilization. Block-5 Nutritional Status, Food Habits and Food Misconceptions. Unit-15 Assessment of Nutritional Status. In the previous units you have learnt about the body's nutritional needs in various stages of the life cycle. Now you may question as to how one can judge whether a person of a particular age group has normal health or is under or overnourished. Let us try to find out the answer to this question in this unit. 15.0 Objectives. After studying this unit, you will be able to explain the effect of normal nutrition on the body and its performance. Describe the methods used to determine nutritional status. Describe the methods used to measure body size, weight and height, and help monitor growth of children. 15.1 Introduction. So far you have learnt about the body's nutritional needs through the various stages of the life cycle. You have also understood how to meet these needs by proper selection and intake of foods. One of the questions you may be asked by people is, does nutrition really make a difference in your life? The answer is definitely yes. The next question is, how do you know if one is well nourished? Let us try to answer these questions. 15.2 Does nutrition make a difference? As you learnt in Unit 5, a person's growth rate and size is decided by two main factors, his/her inborn capacity to grow and the environmental conditions. Of the latter, nutrition is one important condition, which you can modify. Obviously, these two factors depend on each other, because heredity decides the final size and whether you will actually reach that size is largely dependent on your nutrition. In other words, the blueprint is in your heredity, but the bricks and mortar are in the variety of foods you eat. Body size. You may have noticed that there is a progressive increase in the body size with growth. Two simple measurements help you to record the changes in body size, viz. Weight and height. Besides the skeletal frame, your body has soft tissues such as muscle and fat. It is difficult to measure muscles, but you can measure the amount of fat. One way of doing it is to measure the skin fold thickness. Performance. Besides body size, your nutrition affects your capacity to learn, to work and to live a long happy life. As you have learnt in Unit 5, your brain is the fastest growing part of the body. By the time you are 2 years old, 90% of your brain size is reached. The most rapid growth of the brain takes place from the second half of pregnancy up to the 10th month of infancy. You will appreciate how important it is to ensure that the mother and infant are fed well in this period. Another aspect of learning is the ability to concentrate. You know that children who are hungry are unable to concentrate on their schoolwork. Many factors affect your capacity to work, and nutrition is an important factor. It was found that increasing the food intake of underfed farm and road building laborers by 30% increased their work output by 50%. As you may have observed, the capacity for physical work is related to your body size. Underweight persons are not able to carry heavy loads for long. When one is malnourished, one is unable to resist infections and may have to remain absent from work frequently. Thus work output is inconsistent and low. You will appreciate then that a well-fed, productive citizen is an asset to the workforce. For example, when anemia was corrected by iron therapy among individuals in Indonesia, their work output increased measurably. Longevity. An Indian child born in 1901 was predicted to live to about 25 years. By 1980, life expectancy of an Indian male had increased to about 57 years, and in 2006 the life expectancy at birth for Indian male and female has increased to about 63.8 and 66.9 respectively. The gain in life expectancy has been made possible by controlling certain diseases such as smallpox, tuberculosis and some childhood ailments. It is difficult to assess the exact role of nutrition in life expectancy. But if you look at improvement in life expectancy in countries where people are well fed, you can see that it does make a difference. For example, the life expectancy of people in countries such as the USA and UK is reported to be 78 years and 79 years respectively. With the knowledge you have gained in this course, you can help to achieve this goal. You will certainly agree that this is sufficient evidence for us to take care of our health and well-being through appropriate nutrition at all stages of the life cycle. Check your progress exercise 1.1. Explain how learning is affected by nutrition. 2. What is the effect of nutrition on work performance? 3. Fill in the blanks. A. The two simple measurements which help you to record body size are, and B. By the time you are 2 years old, % of your is reached. You are listening to this audiobook on Audio Learn IGNOU. 15.3. Nutritional status. You may have realized that nutritional status is the level of nourishment of your body at a given point of time. Each of us would like to maintain our nutritional status at an ideal level. So far you have learned that nutrition affects your body size, your brain development, your performance, your capacity to work and lifespan. Nutritional status reflects the kind of nourishment your body gets from the foods you eat. If foods meet your body's needs optimally, you look and feel healthy and you enjoy ideal nutritional status. The child that is born on a Sabbath day is bonny and happy and good and gay. This nursery rhyme reflects our desire for normal health and happiness and describes a child who enjoys good nutritional status and health. When you think of signs of good nutrition, you think of a healthy complexion, bright eyes, a good figure, a positive, happy temperament, willingness to work, etc. In short, a person who is an asset to the family and community. These are some of the indicators of normal nutritional status. You can measure and record some, while others are qualitative ones and cannot be easily measured. Body size is a gross indicator of nutritional status. Let us get acquainted with the methods used to measure body size. Check your progress exercise 2.1. Describe the signs of good nutritional status. 2. Fill in the blanks. A. Nutritional status reflects the your body gets from the B. Body size is A. Of nutritional status. 15.4 Measurement of body size in Units 5 and 7. You have learnt that body weight and height indicate your body size. In addition, the head, chest and mid-arm circumferences give an idea of growth and development, especially of small children, 0 to 5 years. So you record these body measurements at various stages of development to study the growth pattern. Let us get acquainted with the correct methods of recording these measurements. Weight. Weight is a commonly used indicator of body size, as it reflects the level of food intake. You know that in the hospital a baby is weighed soon after birth. Even babies born at home are weighed by the visiting midwife or nurse on a portable weighing scale. The normal weight of a healthy baby varies between 2.5 to 3.5 kilograms. If the baby weighs less than that, you need to take special care to see that the baby attains good health as soon as possible after birth. After birth, it is advisable to maintain a record of the baby's weight at monthly intervals. You can advise your family members and neighbors to maintain a periodic record of their infant's weight. You will realize that the scales used for weighing babies need to be more sensitive than those used for weighing adults. Baby scales, which have 100 gm divisions, are ideal for weighing infants. Figures 15.1 and 15.2. Another weighing scale used by field staff of various agencies is a portable one, which can be hung from a roof or a tree, and as shown in the figure, has a sling to hold the baby. When a baby scale is not available, you can use an adult weighing balance and record the weight of child with mother and then the mother alone. The difference of the two weights is the weight of the child. You can record the weight of children regularly to check if there is a normal gain in weight. The weight can be plotted against age to see if the pattern of growth is normal, by comparing it with the normal curve presented in Figure 5.3a and 5.3b in Unit 5. If child fails to gain weight and does not follow a normal pattern of growth, you must find the reason and take remedial action. You can compare the weights of adults with the weight for height, Table 7.2, given in Unit 7. As you noted in Unit 7, weight record helps to check energy balance in adults. You can also compare your body mass index with the Table 6.1 given in Unit 6 of Block 2 to check whether you are underweight, overweight or obese. Linear measurements. As you noted above, a number of linear measurements are included in this group, such as height, circumferences of head, chest and midarm, and skin fold thickness. Let us get to know to record each of these. Figure 15.1. Weighing preschool child with standard UNICEF balance scale. Look at the screen for table content Figure 15.2. This is the hanging weighing scale which is strongly recommended. As illustrated, the child may be placed in trousers or a number of other receptacles, depending on the local culture. Look at the screen for table content height. Height is another measure of growth of a child. As you have learnt in Unit 5, there is a 50% increase in height in the first year and a child reaches half of his/her adult height by the second birthday. Thus, recording height helps you to know if the child is growing normally. You can use a vertical measuring tape scale fixed on the wall to record the height of older children and adults. Figure 15.3a. The scale used for measuring height should be 2 meters in length and capable of measuring to an accuracy of 0.2 centimeters. You need an infantometer to measure the length of infants. It can be made by attaching a scale to a shaped wooden board. Figure 15.3b. You can place the infant on it with head touching the headboard. The knees are extended by gentle pressure. A light wooden block is moved to touch the heels and the length is read to the nearest 0.1 centimeters. It is obvious that an infant cannot stand and so its length is measured with the body stretched on a board. If you record the weight and height at regular intervals, the weight for height can be checked. Table 15.1 and Table 15.2. Table 15.1. Weight for length for girls and boys, birth to 2 years. Look at the screen for table content Figure 15.3a. Height measurement of school child. Look at the screen for table content Figure 15.3b. Length measurement of infant. Table 15.2. Weight for height for girls and boys. 2 to 5 years. The weight for height is a sensitive indicator of current nutritional status. It is useful as it requires no knowledge of age. It is age independent. Low weight for height is indicative of wasting or thinness. On the other hand, more weight for height indicates overweight and obesity. Body mass index for age, BMI for age, is another index for assessment of nutritional status of children, 5 to 19 years, in terms of both overnutrition and undernutrition. Table 15.3 gives the median BMI for age for children between 5 to 19 years. Table 15.3, BMI for age median, BMI in kg/m2. Look at the screen for table content from the figure 15.4. It will become more clear how BMI is a good indicator of the nutritional status in children. The child in figure 15.4a is a normal child as he has normal height, and in figure 15.4b the child has normal height but low BMI and appears thin, so he is a wasted child. The child in figure 15.4c is less in height but has a normal BMI, so he is a short child. The child in figure 15.4d is less in height and has low BMI, so this child is short and wasted. Figure 15.4. Body mass index, an indicator of nutritional status. Head, chest, mid-arm circumferences. In addition to height, 3 other length measurements help you to note the growth status of your body. These are head, chest and mid-arm circumferences. You will find that these are very useful to check growth in small children. You can measure these very easily with a measuring tape and record these. Look at the screen for table content -head circumference. You have noticed that babies have a large head at birth compared to the rest of their body. The head circumference continues to increase rapidly up to 6 months after birth, and then it increases slowly. You use an arrow, less than 1 centimeter wide, flexible, non-stretch tape to measure the head circumference. Please avoid using a cloth tape, as it tends to stretch with use. You measure the greatest head circumference by placing the tape firmly around the head and passing it at the center of the forehead. Please be sure that it is at the level on each side of the head and it passes over the maximum protrusion, which is called the occipital prominence, at the back of the head. Figure 15.5a. Measure the head circumference to the nearest 0.1 centimeters. Head circumference is often used in clinical settings for screening the potential development in children but is of less value for assessing the nutritional status. Chest circumference. It is useful as a measure of growth only up to 3 years. If your child grows normally in the first year, the head and chest circumferences are almost equal at about 6 months of age. After that, the head grows slowly and the chest more rapidly. Table 15.4. The chest/head circumference ratio is useful to detect undernutrition in early childhood. Table 15.4. Head and chest circumference measurements in first 5 years. You can use the same tape, which you use to measure head circumference, to record the chest circumference. Be sure to measure the chest circumference at the nipple line, preferably in mid-inspiration, that is halfway between full breathing in and full breathing out. Figure 15.5. C. Please do not take the reading when the child is crying or breathing irregularly. Measure the chest circumference to the nearest 0.1 centimeters. If you find that the chest circumference to head circumference ratio is less than 1 between 6 months and 5 years, you know that the child is undernourished and needs special attention. If you don't have a tape measure, you can compare the two circumferences with a piece of string and note if the chest circumference is more or less than the head circumference after 6 months of age. Mid-upper arm circumference, MUAC. The mid-arm circumference gives you an idea of the size of the arm muscle and the fat layer below the skin. 2. Measure arm circumference. You let the arm hang loosely by the side of the body and measure the arm circumference at the midpoint of the upper arm, between the tip of the shoulder and the elbow. Figure 15.5. B. Use a measuring tape with divisions of 0.1 centimeters, the same tape used for measuring chest and head circumferences. MUAC is proposed as an alternative index of nutritional status in emergency situations such as famines and during refugee crises. Low MUAC based on fixed cutoff points of 12.5 centimeters can be taken as an indicator of wasting. Look at the screen for table content. Figure 15.5. Measurement of head, mid-upper arm and chest circumference. Skin fold measurement. About 50% of the fat in your body is in a layer directly beneath the skin. Insufficient intake of calories over a period of time leads to reduction in the thickness of the fat layer under the skin. You can measure the double layer of skin and subcutaneous fat, which is known as skin fold thickness, by using skin fold caliper and tell the state of fat reserves of your body. This measurement helps you to know the extent of the body's fat reserves. If the reading is lower than the norm, you are undernourished. If it is higher than the norm, it indicates obesity, which has an adverse effect on your health. Skin fold measurement can be used along with other measurements such as Weight for height to evaluate nutritional status. However, skin fold measurement requires more training and expertise than measuring weight and height. Generally, in order to evaluate nutritional status, weight and height are the easiest to determine. In small children, the three circumferences are also very useful. Check your progress exercise 3.1. Why is weight measurement important in early childhood? 2. List the linear measurements used to record growth in children. 3. What is the significance of head and chest circumference in the first year? 4. Match the following. Look at the screen for table content 15.5. Growth monitoring of children. Growth monitoring is very important in children. As children between 0 to 5 years are at a vulnerable stage of growth, detecting any faltering in growth is very useful. At this stage, it is possible to bring the child back to normal state by judicious improvement in food intake. Thus you can prevent further adverse changes, which take longer to reverse and hence cost more. You have learned how to record the physical growth by taking weight, height and head, chest and mid-arm circumferences of children. You should carry out these measurements at regular intervals and record these. You must be wondering how often these should be measured. The infant grows very fast, so you should record these every month in the first year, every other month in the second and about once in 3 months from 3 to 5 years of age. Monitoring growth, weight and height. First check if there is an increase in weight each time you weigh the child. If you find successive increase in the weight of a child, it shows that the child is growing. Secondly, check if the weight increase is normal by comparing with the growth curve, figure 5.4a and 5.4b. When you compare this weight increase with the growth curve, you can see if the weight increase is normal. Thirdly, compare the weight for height with the help of the growth chart. The comparison of the weight for height with a growth chart tells us if there is proportional growth of the body. Monitoring growth. Other measurements. You have learnt that the head circumference is greater than the chest circumference until the infant is about 6 months old. After that, the chest circumference exceeds the head circumference. If you find that the chest circumference is less than the head circumference between 6 months and 5 years, you know that the child is undernourished and needs special attention. Therefore, these measures are useful only in early childhood. The mid-arm circumference is a gross measure of body fat reserve and muscle development. When a child is chronically undernourished, there is poor muscle development. The muscle tissue and fat are used up to meet the body's need for energy. This results in reduction in mid-arm circumference. Therefore, you can measure it to detect undernutrition in young children. Note that it is useful only when there is no edema. You are listening to this audiobook on Audio Learn IGNOU. 15.6. Adults and their body size in India. A large number of adults suffer from malnutrition. As you may remember, adults normally maintain the body weight attained at 25 years of age, if that was desirable weight, throughout their life. A change of plus 5% away from this weight must be a cause for concern. Periodic record of weight can help to detect a change in the early stages when simple modification in food intake may be needed to return to normal state. At the other end of the scale, you may find those who have started gaining weight, especially after 35 years of age. As already mentioned above, regular monthly measurements of body weight can help to note the changes in weight early enough to avoid becoming obese. Other measurement that is useful in adulthood is body mass index, which is used to detect whether a person is overweight, underweight or obese. You have already read about the BMI in Unit 6. 15.7. Clinical examination. Clinical examination is one of the simplest methods to assess the nutritional status. It involves looking for changes, clinical signs/symptoms, in the body which are indicative of a particular deficiency. This method does not require expensive apparatus. However, it requires an experienced investigator to assess the symptoms. With careful training, we can learn to recognize the crucial clinical signs while conducting the clinical examination. Table 15.5 summarizes the clinical signs and symptoms which we should look for in clinical examination. Table 15.5. Classified list of signs used in clinical examination. Area of examination signs known to be of value in surveys. 1. Hair, lack of luster, dull, dry hair, sparseness, discoloration. The hair loses its black color and appears reddish-brown. Easy pluckability. 2. Face, moon face. The face appear puffy with the cheeks sagging. 3. Eyes, conjunctival cirrhosis. Dryness of the transparent membrane that cover the cornea and lines inside of the eyelid. The conjunctiva becomes discolored, muddy-colored, and loses its brightness. 0. Ophthalmia, including keratomalacia. Cornea becomes soft and raw and easily infected. Betos spot, dry foamy, triangular spots appearing on the temporal side of the eye. Night blindness, inability to see in dim light. 4. Lips, angular stomatitis, lesions, cracks, appearing on both the sides of the mouth. Angular scars, healed lesions of angular stomatitis. Chelosis, lips develop cracks and become red. 5. Tongue, red and raw. Tongue is bright red in color and very painful. Magenta tongue, tongue is purplish red in color. Atrophic papillae, papillae have disappeared, giving the tongue an extremely smooth appearance. 6. Teeth, mottle enamel, mottle teeth with chalky white and brownish areas with or without erosion of the enamel. 7. Gums, spongy, bleeding gums, purplish, swelling of the gums, bleeding on slight pressure. 8. Glands, thyroid enlargement, gland is visible and enlarged. Enlargement might be diffused or nodular. 9. Skin, xerosis, generalized dryness with desquamation. Dermatosis, skin lesions which are symmetrical and are evident only on the parts of the body exposed to the sun, like forearm, legs, face and exposed part of the neck. The skin becomes dry and scaly. 10. Nails, brittle and spoon-shaped. 11. Skeletal system, beading of ribs, pigeon chest, protruding breastbone, knockness or bow legs. 12. Internal systems. A. Gastrointestinal, enlargement of liver, soft, firm, hard, enlargement of spleen. B. Nervous, irritability, forgetfulness, headache, sleeplessness, mental depression, loss of orientation, not being able to relate to time, place and events. 15.8. Biochemical assessment. Now that you know about the various external body measurements like height, weight, MUAC etc. and clinical methods for assessing the nutritional status, we will now get familiar with different biochemical tests that can be used to assess the nutritional status. Biochemical assessment mainly deals with measuring the level of essential dietary constituents, nutrient concentration, in the body fluids like blood and urine. Table 15.6, 15.7, 15.8 and 15.9 depict the different biochemical tests that are used for diagnosing anemia, iodine deficiency disorders, protein energy malnutrition and vitamin A deficiency, which are the 4 major nutritional deficiency disorders affecting large population groups in our country. Table 15.6. WHO Guidelines for Diagnosing Anemia. Look at the screen for table content. Group cutoff for hemoglobin, G/D. Children less than 6 years 11, children 5 to 11 years 11.5, non-pregnant and non-lactating adult women 12, pregnant women 11, lactating women 12, adult males 13, children 12 to 14 years 12. Table 15.7. Criteria for defining the iodine status of a population based on median urinary concentration. Look at the screen for table content. Iodine status, median urinary iodine concentration, microgram/L. Severe iodine deficiency less than 20, moderate iodine deficiency 20 to 49, mild iodine deficiency 50 to 99, ideal iodine intake 100 to 199. More than adequate iodine intake may increase the risk of iodine-induced hypothyroidism. 200 to 299, excessive iodine intake greater than 300. Table 15.8. Serum albumin levels as an indicator to assess protein nutritional status in children less than 5 years, malnourished children, Look at the screen for table content. Albumin status, serum albumin level, G/D, 1 deficient, high risk, less than 2.82, low, moderate risk, 2.8 to 3.43, acceptable, low risk, greater than 3.5. Table 15.9, vitamin A status based on serum vitamin A levels. Look at the screen for table content. Vitamin A status, serum vitamin A levels, microgram/dl, micromole/liter, 1 deficient, high risk, less than 20, less than 0.72, low, moderate risk, 20 to 30, 0.7 to 1.053, acceptable, greater than 30, greater than 1.05. 15.9, dietary assessment. You have learnt that your nutritional status is altered by the amounts and kinds of foods you normally eat. In the first part of this unit, you have got acquainted with some of the physical measurements which can help you to assess the nutritional status. Condition. If the condition is not satisfactory, you will want to modify your diet. How will you do it? You must know the present food intake pattern to be able to modify it suitably. Hence, the dietary assessment needs to be carried out. When and how to record food intake. You need to know your normal or habitual pattern of food intake. So you select 3 normal working days to record the food intake. On Sundays, holidays and festivals, you generally have special menus, and the schedule of eating changes. So please avoid such days while recording your normal food pattern. You write down the foods you eat each day at each meal. Please record the snacks, fruits and beverages you take between the meals, or with the meals. Record the amount of each preparation eaten and also the time when you ate it. The amount can be recorded either in volume or weight. Later you can convert all the amounts into weights. This process of conducting the dietary assessment is the 24-hour recall method. In Unit 3, you learnt about normal servings of individual foods. You will find that knowledge helpful in recording food intake. Please pull the data as shown in Table 3.1. Evaluation of food intake data. You can evaluate the food intake to check how the food selection compares with the daily food guide. This is qualitative check and will help you to identify if any of the food groups are missing from the day's intake. Secondly, you can compare the amounts of foods taken with the suggested minimum number of servings to see if the amounts of foods included are insufficient. This evaluation will help you to decide what changes need to be made in the diet to improve the nutritional status. Check your progress exercise 4.1. What is growth monitoring? 2. How would you monitor growth of children? 3. Why is dietary assessment important? 4. Explain how you would evaluate food intake data of a preschool child. 15.10. Let us sum up. In this unit you have learnt that ideal nutrition is essential not only for optimal growth and development of your body, but also to ensure your capacity to work and longevity. Therefore, you would like to maintain a normal nutritional status. You can use several methods to measure nutritional status of individuals. You can record physical measurements such as weight, height and skin fold thickness for all individuals. In addition, you can record head, chest and mid-arm circumferences of small children, below 5 years, to assess the nutritional status, if needed. You can record the normal dietary intake so that it can be modified suitably to improve the nutritional status, if there is a need to do so. 15.11. Glossary. Assess, evaluate, estimate. Edema/edema, swollen state of body due to retention of fluid. Heredity, the phenomenon of inheritance of characteristics from parents to offsprings. Life expectancy, a statistical prediction at birth about the number of years a person can be expected to live when he or she is born in a particular country. Test based on the general health conditions and vital statistics of that country. Longevity, long life. Monitor, to keep control through regular vigilance. Vulnerable, liable to be easily affected. 15.12. Answers to check your progress exercises. Check your progress exercise 1.1. The most rapid growth of the brain takes place from the second half of pregnancy to the 10th month of infancy, and this mental growth is directly affected by the nutrition received during this period. If nutrition of the pregnant mother or infant is inadequate, the development of the brain will be affected. The ability to concentrate among school children also depends upon the food they eat. Hungry children are not able to concentrate and therefore their learning ability is poor. 2. Food gives energy to do physical work. Therefore, if laborers involved in physical work are underfed, they will have less energy to work and their work output will be decreased. 3. Fill in the blanks. A. Weight, height. B. 90%. Brain size. Check your progress exercise 2-1. The signs of good nutritional status are a healthy complexion, bright eyes, good figure, a positive, happy temperament, willingness to work, etc. 2. Fill in the blanks. A. Kind of nourishment, food you eat. B. Gross indicator. Check your progress exercise 3-1. Weight gain during childhood indicates the pattern of growth of the child. In case gain in weight is not normal, it requires remedial action. 2. Height, head, chest and mid-arm circumferences, skin fold thickness. 3. Head circumference continues to increase rapidly up to 6 months after birth, and then it increases slowly and is therefore useful as a measure of growth in the first year. If growth is normal, head and chest circumference are almost equal at 6 months. The chest/head circumference ratio is a useful indicator of growth in early childhood. 4. Match the following item. Item B1. There is 50% increase in height in the first year. 2. Head circumference is greater than chest circumference at birth. 3. Mid-arm circumference is an indirect measure of fat reserves. Check your progress exercise 4-1. Growth monitoring is the regular measurement of growth in children to check if growth is normal. Any faltering in growth can be detected by growth monitoring and corrected by improvement in food intake. 2. Growth in children can be monitored by taking their weight, height and head, chest and mid-arm circumference. 3. In case the nutritional status is not satisfactory, the diet has to be modified. This would require an assessment of the present diet before any modifications could be made. Dietary assessment would indicate where the diet is lacking. 4. Food intake data of a preschool child would be evaluated by comparing it with the daily food guide of that age group. This would indicate if any food groups are missing. Secondly, the amounts of foods taken can be compared to see if intake is sufficient. Thank you. We will see you in the next video.